I might have missed a slide, but yeah, just in the general speak. So I'm going to go into what you're going to hear me use a term called a dashboard. This is a cloud-based HIPAA compliant platform that we train folks to use, and then they begin to use it. So you could go to the next one. The first thing that, when we start these projects and do the kinds of work that I do with them, the meeting host, the requirements or the devices is a laptop or a desktop with a mic and a camera. They could do it on a smartphone or a tablet, but we don't recommend it. It's being able to see some things and move it around. But on the user end, the client, the student, the parent, anything that has one bar on a smartphone or a mobile device, could be a laptop, desktop. It's really good about understanding the differences between Apples and Macintosh and adjust itself without having to do a lot of things. So the 2 points of those connections are the therapist, and we always say, a laptop or a desktop with a camera, that's your preference. And then on the other end, whatever they have, honestly, that they can connect with. If you can go to the next one. This particular slide is a piece of quality assurance and part of a core competency for telebehavioral health that we're working on a credential that I'll talk to you a little bit about later. But one of the big differences in telehealth versus, in person, and folks who are very comfortable and very familiar and, face-to-face is, the preferred way and the way that they've always done things and a lot of those things. But once you are not doing it face-to-face, like if you look at my screen, behind me is a mess, but my telepresence appears that I have this wonderful office looking out of windows. So some of the transitions that can be a challenge for the workforce is this thing called telepresence. And these are just a few of the considerations that you have to start thinking about when you decide that you're going to use the technology to deliver your services. Things that in your office you might tidy it up, but these are different kinds of things that I just wanted to kind of throw out there, and I'll talk a little bit more about the core competencies and those things a little bit later, but there's some real differences to it. The goal is to try and replicate what happens face-to-face, and it's not that it's a new thing, it's just a different way of doing what you normally do. The credential itself is kind of built off of that, in the sense that the credential is how to use the technology and the core competency and skills that you need to be able to effectively deliver it. It's not the particular subject or your particular realm of practice that you're delivering. So if you can go to the next one. So what we're going to do now is kind of go through the actual telehealth platform. So you all get a copy of this, and that where it says how does it work will be a link on the document that you get at the end. That will take you to, I'd say, 50 to 100 1 to 3 minute videos that are very brief, that are going to be some of the things I'll show you in screenshots of really details about how the thing works. We're going to talk about this thing, a dashboard, and how to navigate it. I'm going to show you a little bit about how you schedule a session, some of the key functions that are important, that whenever we deploy one of these, and we provide the training that comes primarily from the vendor, but then we come in and we start doing core competency checks and letting them practice with each other and making sure that they're ready to do this, because sometimes you only have one chance to make a first impression. And being able to be comfortable with the technology, understanding the different things that makes it different, and knowing how to using it, and really just practicing is a big thing. The e-documents, screen sharing and e-documents, I'll show you a little bit about those and talk about them, because when you're doing it virtually, you don't have a waiting room and you don't have the typical clipboard and those kinds of things. One of the things that we'll talk about too in here is something called a secure chat and file transfer. It's very unique because you can engage someone through a text message, and you can also share files with them in HIPAA compliance with simply a cell phone number, and they can sign those documents. You can store them. They're all in that. And SOAP notes would be, I'll show you a little bit about how the interface and how easy it is to put those things in that you can then pull out for billing and things like that. But I say all these things to you because since COVID-19, they've kind of said, we're not really worried about HIPAA. And if you want to use Zoom, if you want to use FaceTime, they're not really pursuing us, so to speak. But patient information to me is very important, and having a HIPAA compliant platform, even though it may not be required today, I don't think that should ever go away, in my opinion. I think protecting folks' digital data is very important, and this HIPAA compliance is, is there for a reason. I think hopefully it'll come back, and the good thing about this is that it was all there before. So if you can go to the next one, Natasha. So this is literally part of the help files that comes with this. And so when we implement this projects like I do, we kind of utilize all the resources that Let's Talk Interactive has, and then we kind of work with them individually and customize those things. So literally when you create a contact, you click on the little guy, a contact, and then once you put that, the only thing you have to have is first name, last name, email, a cell phone number. And one of the things that's pretty important in this is a particular time zone where they're located at. The system's smart enough to adjust the hours based on that, but the actual contact that you create, you can edit all of these, after the fact. But if you go to the next one, Natasha. In the managing contact, so once you've put a contact in with first name, last name, email, and cell phone number, from that point forward, when you begin to type in your dashboard, you don't have to retype it every time. It'll kind of remember that person's name and the contact, and so it saves it. And so you can click on that and save you a little time from entering them in. You can go to the next one, please. Now, this is really similar to what we're kind of in now. And you see up there at the top that it really is a Zoom room. But one thing I want to say to you is that we're not using Zoom in the sense that the Zoom platform, there's no Zoom account in this platform. Without getting too far in the weeds, it's a widget that kind of goes to a secure version of Zoom that does not, you don't get Zoom bombed, if you guys have heard of those little incidences that happen. But one of the things that as a practitioner and a therapist, or however you're using this, understanding how to use the tool, but if you can't make a full and complete connection on the person on the other end, then you can't really have a meaningful encounter. So we always kind of go through the two things, how to troubleshoot the speaker and the video and the audio. So you can see from this little diagram, they're very simple little things. When you click on that, this system is smart enough to kind of run through and do some diagnostics, and about 90% of the audio and video problems that we run into, one click of the mouse and walking them through that will kind of remove that barrier and allow them to engage in the meeting most of the time. That doesn't solve bandwidth issues. We'll talk about a little bit later, but I show this to you because it's part of what you need to know if you're going to use this. You got to be able to do a little bit to get that other person to connect with you so you can have a meaningful event. You can go to the next one, please. This is actually the interface that you would look at as the therapist. So you've got your contact in, you're kind of ready to do the troubleshoot when you are going to do that. So you've got two options. You can schedule a session now. You can schedule a new session in the future, and those are really the only two things that you will need to know. So if you've got nothing in your dashboard when you log in, you'll see what that arrow to the left is. Basically, what do you want to do? You want to do a meeting now, or you want to schedule a session? If you've got things in your dashboard when you log in, you'll see that you've got a meeting there, and it tells you who it's with because you've kind of scheduled that beforehand. And that little add a participant there is very nice, because what that means is you can constantly add up to, you can have 100 people in here at a time, so you can have 99 plus you. So you can add them when you're in there. You can edit them and do those kinds of things. I'll touch on a little bit that start the chat, we'll talk about in a little bit. That button there is where you could engage in a chat with a cell phone and HIPAA compliant, share files, those kinds of things, just by clicking that button that's right next to in the green enter now and that, and then you can manage it and edit the names and then the session notes. But that's kind of what you see when you get into that dashboard. You can go to the next one. And so I kind of just touched on this. This is if you can either schedule it now and click on that, or you can schedule it in the future. If you decide to schedule it in the future, it literally just pops up with a calendar. You pick your time and then go, and then that meeting gets scheduled. It can go to the next one, please. You've got two options. You can either do this through an email, or you can do this through a cell phone and a text message, or a smartphone and a text message. So you select which one you want to do, and then it will automatically send that notification out for the person to join you. You can see down at the bottom of this slide, it has something for payment required. That's just kind of built into the Let's Talk interactive system. We don't use it, but some providers, some people find it very useful. One of the things that we do with the system is to get in the data out of the back of the database. We like to be able to classify, which the system allows us to do, what is the service that we're going to provide, so that we can see how many minutes of child-focused therapy we were doing. But that could very easily be a billing code for an IC-10 for billing, a type of service that at the back end of the system you would be able to extract out for billing. You've got some notes in there that you could do for cases and files, case management, and those kinds of things. So there's really just those two things, an email and a text message. You kind of pick that every time you schedule a session, or just send the invitation to them. You can go to the next one, Natasha.
I see. Drive careful.
This is kind of the types what the person that you're inviting to the meeting will receive. So on the left, this is what they get through an email, and you see the box there where it says join session. So literally when you've invited someone to a meeting or it's time to join, the system will send out an email for you to confirm that you're going to be there, add it to your calendar if you choose. And then 2 hours before the session, you're going to get a reminder. And then 10 minutes, you get a reminder to the participant. And that's kind of built in, comes automatic. If you were looking at it through a text message, that's just an example of what it would look like on the right. So that link of that you see on the text message, you click on that and it takes you, into the meeting. So you can go on to the next one. Because a lot of folks are doing this with a smartphone, and part of the kind of a troubleshooting thing and the pieces you need to know as a therapist to get through those first couple of humps of connecting the audio and the video and, getting a viable session started. Those are some screenshots of what it looks like on an Android. And basically you're kind of saying you're going to allow them. And on an iPhone, it's a little bit different. You just call using internet audio. Those are the two little things that will pop up once you say join the meeting and you're on a smartphone from the other end. Those are the kinds of things that they're going to get from the end user that they have to be able to navigate, and you as the therapist kind of are being prepared to navigate that through that with them. Sometimes it means get them on the cell phone, or some alternative types if you need to. You can go to the next one. One of the things I said before about Zoom, and there are a lot of things somewhat negative, in the COVID-19 of, maybe Zoom is not secure and some questions in that. But again, I want to stress this, we're not really running Zoom here. We're using a widget that is not going to Zoom, but it utilizes Zoom, to deliver the thing. I know that doesn't make a lot of sense, but they've kind of assured me, and they explained it to me in a way that I actually get it. You're not installing Zoom on your device. You really aren't. You're just installing the widget. You don't create an account in Zoom. You have to encourage folks not to, because sometimes they'll have one and they'll be in the wrong place waiting for you when they should be over here. It's a barrier that we work through all the time, and it's not the end of the world. But we always say, don't install it, just okay. And then once you've done that on your computer, you don't have to keep doing it. That stops showing the message that's down at the bottom there. Once you do that, you don't get it anymore. It looks a little different on a smartphone. You just get it from the App Store, and once it's there, you don't register it. You don't create an account. You just install the Zoom widget. You can go on, please. So this is what finally pops up, and you are the client who has received this, and you can see you're going to enter the waiting room. You also have an option up there that you can see where you can dial in. So if you click that button, if something's gone wrong or things aren't really, your connectivity, or you're having trouble, you can always click and dial, an 800 number and connect with your therapist. Still HIPAA compliant, still inside these dashboards on that end. But once you click on the enter the waiting room, it's like going to the doctor, right? It's like, instead of getting the clipboard and here, go fill this out. And then when you get that done, bring that back. And when the doctor's ready, we'll see you. Well, some of these things I'm going to talk about with e-documents really try and replicate that. So if there's consent forms, if there's treatment plans, if there's a payment, you can kind of condition the client, conditionalize things that the client would have to do to be able to enter into the waiting room. And you as the therapist would get a notification on your email or through your cell phone that there's someone waiting for you in your waiting room, and you can see if they've signed the documents, filled out the forms, made a payment if those are the kind of cases, whatever those conditional things are that you set, that those things are kind of done. But that's kind of what you see from the client or the patient standpoint, the interface. So you can go on to the next one. One of the things that we find that's kind of some of the things that we use all the time, we're going to talk about just a few of them. That's what it looks like when you do a screen share. So whatever you've got on your computer, you can share that with the client. That can be a video, it can be an activity, it can be anything that you can screen share with them. It can be the treatment plan that you're working through to get concurrence and agreement that you're going to make these kind of modifications and changes to it. It could be in a screening and an assessment. Those are all common uses that the technology works really well for. And so you can kind of pick and choose whatever you've got open on your machine that you can share with the clients on the other end, and then just click that share button in the bottom and you can do that. You can go to the next one, please. One of the things that's nice is that the system allows you to create your own e-documents, and we get a lot of support from Let's Talk Interactive, and they help us out, and we just kind of give them the forms and they come back magically done. But we can create them, and it's literally, I haven't found a form yet that a provider, we have over 100 providers in the school-based project that are therapists that deliver services. And then since COVID-19, we added 240 child welfare workers. And each of those folks have different types of documents, from home inspections for child welfare to foster visits to visitation. I can honestly say there's probably 80 to 100 forms that have been created that were paper that are put into this system. And when they're going to this system as an e-document, they can be attached to part of what you get in the meeting room, to join as part of a conditional thing. We'll show you in just a second. But you can also create your own because you've got a dashboard account. So whatever the forms are, if you can go to the next one, please, it'll kind of make a little more sense. These are all hot links. So when you get your PowerPoint, if you're curious about this kind of a thing, when you click on the link box, it will literally walk you through the form creation process. Those are your options: text box, text area, radio buttons, those kind of things. There's not, I haven't found, like I said, I haven't found a form that we couldn't kind of recreate so that it could be used over and over in this system. And we can assign it to packets, which means you've got a bundle of forms if they're all consistent, and you do it for, a demographic intake, a treatment plan, an assessment, whatever those forms are that you have face-to-face, you can replicate it in the system and be able to do it virtually. And you can go to the next one, please. So there are two ways to get the signature electronically that will come back to them with a stamp. These documents are stored on that HIPAA compliant cloud. You can either type your name or you can have them sign on their phone and type your name. So those are what they look like. When you've got documents that you want signed, you don't have to, it's not a requirement. But the good thing is if you've got consent and you've got some HIPAA forms that you need a signature on, some intake kind of a things, the forms are created, you can put them in the system, and you can retrieve those, print those out as PDFs, store them securely, whether it's a signature or that, it gives you those options. You can go to the next one. This is, you're kind of in that dashboard in that meeting room and you want to start a chat. And that means that just because I'm in the room with the person I invited, I can bring anybody on a cell phone into this HIPAA compliant meeting room just by clicking that start the chat button. And I would literally get them in here. So I could share documents with them. The thing I like, you can go to the next one, please. That's just the interface of how you do it. I went one too far, but I want to say this about the chat is if I wanted to take some private information and transmit it in HIPAA compliance, I could attach a document using down in that send box. It's kind of hard to see, but you can type your message in the chat box down below to send the message, but there's a paper clip there. I can attach any document from my computer, and I can transmit that to whoever's in this chat with me in HIPAA compliance, whether that's a consent form, a treatment plan. I mean, you know, that is one of the things that I really like about this, because I'm always concerned about how you transport and HIPAA. And so to be able to do that and engage someone, you know, inside of a meeting while it's going on, it's kind of a nice thing that I've always found, you know, very useful. And we can go to the next one now. You know, you're kind of back in the meeting, and you're there as the therapist. When you click on the session notes, we used to call them SOAP notes. I think they kind of got rid of that. But down below that, you can see that you can enter some, you can type in there. Those notes go back to some of those numbers that you see with the note tags. They go back into the HIPAA cloud, and you can retrieve those notes based on the session numbers. And so you as the therapist can go in there at any time. You can retrieve those, you can cut and paste from them, print them out as PDFs. A lot of times I know that there are therapists who will put SOAP notes in there, and that thing's while they're doing the session. And then when they come to do their billing, they can have two screens open and be cutting and pasting, you know, things that they wanted to get into revise a treatment plan, or for some billing things that they're doing. So any of those kinds of things, to be able to, as a therapist, to store those things and have them secure and be able to use them relatively easy is a good thing. You can go to the next one, please. Wow, I talked my way right through that, didn't I, Natasha?
Yes, that was great. Do you have anything else you wanted to add before we go on to the initiative, George?
I was told 30 minutes, and look, it's 3:38. So my telepresence seems to be fine, and I'm on schedule. So I will answer any questions as long as anybody has at the end. But I think that's kind of what I wanted to cover.
Awesome. Thanks so much for going through that platform with us. This is just one of obviously many different platforms that are available. This is the one that we have been using through the MHRD, and as well as what we'll be using for this initiative that we'll explain. So the Native Youth Telehealth Initiative will have applications online immediately following this webinar today. They are going to be due May 31st, and it'll be an online application submission followed by a video interview. And we'll have 6 locations that will be chosen from those applicants. So just to be clear, obviously, Let's Talk Interactive is a platform that is open to anyone and everyone. This particular project will be working with us and George to have specific intense technical assistance for 3 months to go over how to use basically a more in-depth version of what George just did with us. And then we will also be providing funding for the platform for 1 year. And so as you can see here, the intense technical assistance for 3 months, and then the funding for 1 year. And then we will also be providing access to a learning management system, which will be a collaborative learning community with the other sites that are chosen. And we'll talk about that in a minute here. We have a slide about that. George will cover what that means. So yeah, this is our tentative schedule from June to August, these next coming months, summer months. We thought it was really important to try to get these sites up and running as quickly as possible. Like George mentioned, there's been such a need, especially because of COVID-19, trying to get telehealth up and running for communities. And so we recognize that it's a high priority, and we wanted to be prompt in our timeline. And then funding for those platforms until August 2021. We will also be helping these 6 sites find sustainable funding options for beyond August 2021. We're very happy to do that. We've got a lot of experience working with grant applications as well. So I'll let George talk a little bit about this workforce development aspect of the project, and then we'll talk about that learning communities platform.
Thank you, Natasha. the slide that we're kind of looking at in the core competencies, they're the client care and virtual environment, legal and regulatory issues in a virtual environment, and technology and telepresence. As part of the project that we're working on, you know, in the Florida Panhandle that I mentioned to you, that's an initiative from the First Lady of Florida. One of the pieces of that is to create a credential that is specific to telebehavioral health. And what I mean by that is that we have a certification board and a group of national subject matter experts that have been working since August to create a credential that I think we have 28 core competencies that the group has pretty much settled on. They haven't settled on a name yet, but they've settled on those 3 areas of where those 20, whatever it ends up being, core competencies will rest. And the idea behind this credential is that no matter if you're a prevention worker, a child welfare worker, substance abuse, mental health, this is how to use the technology. It's not about your particular credential. So it's a voluntary credential. It's something to kind of ensure the safety and well-being of the citizens of Florida, but it'll be a nationwide credential. And part of that will be somewhere between 10 to 15 hours of continuing education that will be a requirement for someone who wanted to get this credential. This workforce collaborative that we're doing, because I'm a provider of continuing education units, the participants in this thing will have met the educational requirement for this certification that will, if it's on time, will be August. And from that point forward, you have the educational requirement, and I can assure you that, you know, the group that we go and the 6 sites, they'll be using this system and they'll be good at it, and they'll have no problem. So those core competencies that I've listed on this slide are part of a framework that will be a credential that will be valuable to folks to kind of demonstrate their skills and competency in how to do whatever what they do, and do it virtually in a secure, compliant, and in a meaningful way. That technology and telepresence, I know I showed you that one slide about the telepresence piece, but you know, there's a lot of things in there in terms of how you light the room and the sound and the audio, and there's just so much there that to just get the platform and start delivering services is not really what we want to do. We want to practice, we want to learn how to use it, and have people there that can help you. So that 3-month period till August will be, you know, we'll get you there. I mean, it's not hard, but it takes a lot of patience and working through it. So in the virtual learning community, you know, those best practices, and part of that will be kind of going over all those core competencies and getting you prepared to do this. But a lot of the things that the continuous quality improvement and working with you on, you know, issues that you have and finding ways to do it better and learning from each other is really a lot of what this is about, right? You learn more from each other and from people who are doing it than, you know, listening to me bestow wisdom, you know, kind of like I have today. The last thing, what was that last slide, Natasha? You got one too quick for me. Oh, the organizational rating capacities. No matter how hard I work with an individual, if the individual is part of an organization that doesn't, if I part of this virtual community is going to be a little bit of assessment about, you know, what kind of environment do you work in? How ready are you? What's your capacity? And are you motivated? Because no matter how hard I work with an individual and teach them all these tools, if their work isn't accepting it, and it's not an issue now, it was before COVID-19, but now it's, you know, I've become a popular guy in the last 6 weeks, unfortunately. But where I used to beg people to learn how to use it, organizations now kind of accept it and they need it, and it just shows in the demand. So the next slide is actually a Moodle learning management system, which is what I typically use, where this particular project's going to start addressing, you know, the Let's Talk things, some videos and secures, looking at the core competencies. There's a few resources that'll be there. So this will be a place where the participants will come. There'll be things there to share, and it's a resource for them and a place to practice and a place to learn from each other, instead of, you know, me bestowing wisdom all the time, but facilitating all the things that you could do in a learning management system, because really that's kind of what it is. So part of the initiative will be, you know, if you're one of the 6 sites, is kind of being willing to do those kinds of things. And I think it's important to kind of know what you're getting into before you sign up. It's not cumbersome, and I'm very understanding and understand everything that's going on right now. And as long as somebody's willing to, give it their best shot, I'll hang in there with you and help you as best I can.
Thanks, George, so much. So that brings us to our question portion of our presentation today. Like George mentioned earlier, all the participants on our webinar today will be receiving this slide deck as well as an evaluation to fill out after our webinar, which we really appreciate you taking the time to fill out. That helps us keep our projects and our products cost-free. And you will see the link to our website there, which is mhtcnetwork.org/native. That's where you will find the applications that we talked about today for this project. So we would love to take the last 15 minutes or so of our time today to answer any questions that you might have for George or I. And I will close the screen share so we can see everyone. And if you want to type in the chat box or use your audio, feel free.
I got a few questions. This is Joseph, the Brown Boys from the Chippewa Cree Health Center in Rocky Boy. Can you, on that one slide, you said you can invite text or email. Can you do both?
Yeah, you could make an adjustment in the, you could send a reminder, and so you've got in and it automatically does its thing, but you can always manage the invitation. So that's where that would happen, that you could send it out one way, then you could turn around and send it out the other. Can you do them both at the same time? That's a really good question, Joseph. But I know you could do it the way I just described, because you can always send a reminder in between the notification that goes out when you schedule it 2 hours before and then 10 minutes before. You can always manage those in your dashboard through manage the invitation and resend, and you could make that change to a text versus the email. That I feel pretty good about. I don't know about both at the same time. I've never tried that one.
Okay, and the citing HIPAA, you had a little tab where you can record the conversation or record the meeting. Mm-hmm. That's all HIPAA compliant, right?
We don't really use that one, Joseph. Thanks for that question, because what we've got is to store that recording in HIPAA compliance, there's an extra charge, for the storage fee. You can do it. The answer to the question is yes, but you won't be able to do it in the pilot. If you paid for it, you could do it. One of the things that we don't turn that recording feature on for that reason. But if you were in one that you paid for and you were willing to pay for the storage, you could do it. The other way they allow you to do that is also to store it on your local machine. We don't really encourage that in any way, but one of the things with the recording that we have noticed for things like clinical supervision, where we have someone who's being supervised to become a counselor, we've had some situations where we have done it so we could store it so a clinical supervisor could review some of those and give them some feedback in a very small kind of a way. But trying to record every session and store it in HIPAA compliance would be a cost kind of a thing that in the projects I work with, we haven't used that, but it's possible.
Okay, last question. You mentioned that you have 80+ forms. Is any of them wraparound forms?
We just, Joseph, you and I should become friends. We just got an intensive wraparound for 2 grants, and we're working on the forms now.
Okay.
Yeah, I mean, you're talking about intensive wraparound and the forms for that, to the care coordination kind of a piece.
Right.
Yeah, we get all of ours from a state resource center that's down in Broward County, but the National Resource Center for wraparound, those forms are all good. Yeah, I don't know if we've got the ones you want already done, but when you get your dashboard, you kind of put your stuff in yours, you know what I mean? It's like, it's your place. Nobody else gets in there but you. So, but yeah, the wraparound forms are possible for sure.
I'm writing some right now because we're going to switch over to Greenway from AccuCare at the Rocky Boy Health Center. So it's one at a time.
You know what happens with us is that we have a real good relationship. You know, we've been in it for a while with the Let's Talk. Honestly, I just kind of say, give me your forms, and I send them off to them, and then they send me an email and say, hey, your forms are ready.
Oh, cool.
So it works. Yeah, it works pretty good. But
Yeah.
when I say there's 80, I mean that's like each agency. I have probably 20 different agencies and 6 different school districts, and they all have their own unique, you know, processes and workflows and forms. And so all of those are kind of in their dashboard, so that when they come in, they're not, you know, they can just apply them and ask the folks who are getting the services to fill them out. So they've been pretty good about creating all those for us, and you can always create them yourself. But in the pilot project, we're going to work with you and get your forms in, and so that you can do what you need to do.
Okay, thank you. That's all my questions.
Thank you. Well, I see, you know, I'm kind of looking at,
I have a question.
okay.
I am calling in because I'm not near my desk. So I don't know if it's connected to my email somehow to be able to get the link or to get the certificate. So how does it automatically, like, how do I get that? Do I just email you guys or?
Yes, thank you for asking. Yeah, if you are on the phone today and we're not able to see your email, please shoot me an email at natasha-peterson@uiowa.edu, and I will be happy to send everything to you. And if you can't remember my email, I'm also on our website, so you could find the contact information on the website as well. And yeah, we'll be sending the slides.
Okay, I think I have your information from my email where I found the webinar.
Yep.
So I'll just go that way. But I just wanted to make sure. Thank you.
Yeah, absolutely, absolutely. And I'm seeing here in the chat as well, as Patrick mentioned, you know, is this similar to telebehavioral health? Yes, absolutely. You can do all of what we talked about using the platform today to do telebehavioral health. And Patricia asked if the slides, that the recording will be possible as well as the slides. Yes, we are recording the presentation today, and we will, as soon as that's processed, we'll be uploading that to our website as well, and we can send that out to you. But it'll take a couple days to do the processing for our recording, but the slides will be immediately available. They're actually online right now. If you went to our website, you can go right to those slides, and we'll send those out to specific emails that we have for all those that are on the call.
You know, I see one that's asking about, can you use the platform done in person? The answer to that is yes. An example I would give you is that there are some school counselors in some of the school sites that do face-to-face with the kids while they're in school. They actually will fill out their forms on their face-to-face, store them in line, and then they kind of manage, you know, their different things through that. So yes, you can do that.
Yeah, George, could you really quickly, there's a couple of questions here. We have, could you address the credential part again? So after if you are part of the 6 sites that we choose, at the end of the 3 months, you will have a national certification. Could you address that?
Not quite, but part of that credential will have an educational requirement.
Okay.
So unique to telehealth. So I'm a provider for the certification board when I've done work for a lot of certification boards around the country. So I've already told them when this credential comes out that I'm going to be working with people so that I'm going to sign off with the authority that I have to give them that educational requirement as being met. It'll be like a certificate for 15 hours, and it'll be, you know, my provider number and that kind of a thing, but they will have met that. I don't think they've come up with a cost on it yet. I mean, I've heard them talk about, you know, you take a test, you got your educational requirement, you are going to have to take an exam because we're doing item analysis now and writing the exam items, but then it will be somewhere between $75 and $125 a year, and it'll be an add-on credential for really just about anything that, you know, you would do virtually versus in face for behavioral health, child welfare, prevention, treatment, intervention, any of those things.
Okay. And then we have, what are the goals of the pilot in addition to implementation and utilization of telehealth? That is a great question, Lynn. Yeah, I mean, the overall goal of this project is to help Native youth connect to Native providers and to increase capacity. And so we are really hoping to focus on implementation, utilization, workforce development in your community, and then getting care to those that are really in need, especially at this time when we're having a hard time connecting to each other. So anything else you want to add to that, George?
Yeah, it's you know, it's different from face to face, and until recently with the COVID, you know, I've mentioned this a time or two. I spent a lot of time trying to convince people that this was a good thing to do, and now it's not a good thing to do. It's kind of like the only way to do. And so, but there's a lot of differences there and nuances. So my goal is to be able to get you to the point as a provider that you can share your Native experiences with other Native people and use this technology in a way that is safe. You're competent in it, and you're comfortable using it. But more importantly than anything is that you're willing to share it with someone else and help them learn how to do it too. You know, as an objective for this. Because honestly, all of the things that I do, when you learn from, if you have one person, and I have one person in an organization now that has literally taken 12 or 15 of their coworkers who really didn't care about this 6 weeks ago, and they're doing 5 and 6 sessions a day. But if it wasn't for that person that really got it, that was inside and knew how to do it, you know, I don't know if we would have gotten as far as fast. So leaving this thing and being willing to share is a real objective for me, to help others learn how to use it.
Thanks, George. All right, we have a couple more minutes. Any other burning questions we have?
Oh, a train the trainer model. Lynn Kelly. Okay, yes. That learning management system I showed you would kind of be the place where everything gets hung. And so there'll be self-paced courses that someone could go through and also meet those education requirements, learn how to use it, you know, use those little certificates of completion for anywhere between a half to maybe an hour and a half of things. But, you know, I like to do things so that the train the trainer model is manualized and it's online, and you've got a lot of resources there. So the best example I could use is I could make Lynn Kelly a facilitator, give her a course. She'd have access to all the digital resources that were in the learning management system. She could conduct her training online to her group, that only her group would be in, you know, the course and the training that she would have, and teaching her how to use the train the trainer model to do it digitally. And because there's going to be people who are going to want to do different things with this, so part of the reason for that learning management system is to identify innovation champions, which would be part of the 6 sites, and teaching them how to do these things so that they can share it, and having a place that it's all stored, and it's a place that anybody they wanted to could get to it and take advantage of the stuff that we build. That's, you know, the technology transfer center lets us do with the, you know, by giving us this opportunity. So yes, train the trainer model. The train the trainer model for the credential, I don't know about that one. I'm going to you can take the courses on the learning management system and meet the education requirement, if that's in the sense, yeah. You could.
Okay, so really quickly before we end, we've got a question from Todd. Todd, I may reach out to you after this call to answer your question, because we're at the end of our time today, and we want to be respectful of those people's times. I know you guys are all very, very busy. So we are really grateful for you joining us today. If you have any other questions, like I said, please reach out to me or George, and we will be sure to connect with you. You will receive a follow-up email after this call with all the resources we talked about today and an evaluation, and we hope to hear from you. So thanks so much for joining us today.
Thank you all. Well, do you see any names you recognize, Natasha?
Yep, a couple. So we're excited about that.